sector tech-enabled solutions to complement all the great work that's happening on the ground to address deep-rooted disparities within Medicaid. We're excited to welcome you to today's showcase of 8 companies that were selected because they have the potential to tackle health-related social needs for Medicaid beneficiaries in our 3 partner states, New York, Iowa, and Kentucky. Across our participating states, there was a strong recognition that if we are to make a real difference in impacting health equity, we must focus on social needs. These 8 companies were selected from over 100 applicants through a robust RFI and selection process that was informed by beneficiaries, state Medicaid agencies, managed care organizations, community organizations, providers, and subject matter experts from across the Medicaid spectrum. Thank you to all who participated in the selection process to help us reach this huge milestone within the MIC program. Since we received so many amazing applications to our RFI, we have decided to host 2 showcases. Today, we will focus on solutions that address food insecurity and care navigation. We will then host a second showcase on June 6th for SDOH infrastructure solutions, and we'll share more on that later in our session. Please be sure to save the date for the second showcase on June 6th. Before we dive in, we have a few quick housekeeping items that we noted on the slide and we'll post in the chat. We also wanted to share that it's our hope that this won't be your typical huge Zoom call. The more engaged you are, the more successful this call will be. So please turn your video on and lean into the conversation. We'll be using breakout rooms to allow us to engage in smaller discussions with the entrepreneurs. So please get ready to jump in and ask any and all questions during the breakouts today. I want to thank a number of people and organizations for their assistance and commitment to this work, including the teams and partners from our 3 participating states, Director Amir Basiri and his team in New York, Director Liz Matney and her team in Iowa, and Director Lisa Lee and her team in Kentucky. Thank you. I also want to be sure and thank all the managed care plans participating in these states for their fantastic engagement. Thank you all. Last and certainly not least, I want to thank our funding partners, Schmidt Futures and Molina Cares, whose support makes this work possible. Thank you to all these partners. We couldn't do this work without you. Now I would like to hand it over to my amazing colleague and the Executive Director of the Medicaid Innovation Collaborative, Binu Ali.
Thanks, Eamon. And I also wanted to add my thanks to all the people who contributed to getting us here today. It's been quite a journey and really excited to be able to finally be at our showcase. So in the chat, we are sharing a link to the welcome packet that Aisha also sent to you by email last week. This packet provides more details on the companies and the presenters, and we're hoping will be a great reference point for you today as you go into having the discussions with the various companies. On the next slide, our program today is divided into 3 parts. First, we'll have some opening remarks. We're really excited to have the Medicaid directors from our partner states here today to talk about why addressing health equity and social needs is important to their work. We're also going to have an opportunity to hear from one of our consumer advisors who's been actively reviewing solutions and participating deeply with us in the MIC process. And then we're going to do a round robin of elevator pitches from our selected 8 companies, and then head into the bulk of our discussion or today is going to be around these breakout rooms where you'll have a chance to meet deeply with 4 companies. So we know it's going to be a great session and really looking forward to spending the next 2 hours with you. So with that, I'm very excited that we have the state Medicaid directors from our partner states today. We're going to hear first briefly from Director Amir Basiri from New York, followed by Director Lisa Lee in Kentucky, and then from Liz Matney in Iowa. So I think I saw Amir come in, and I'm going to ask, oh, there you are, Amir. Thank you, welcome. And I'd love to invite you to share a few words.
Absolutely. I hope you can hear me okay. Good afternoon, everyone. My name is Amir Basiri. I'm the Medicaid director here in New York. I just wanted to give some brief intro and say thank you to everyone, all the health plans, the consumers, the innovators, and the other state Medicaid departments for participating in the MIC process. For New York, it's particularly critical to this focus on SDOH and innovative interventions to provide health-related social needs to members. That is the core focus of our 1115 waiver, which is in the final stages of CMS review. And this entire waiver and what comes thereafter is going to require significant innovation and scale of health-related social need interventions for our populations in the areas of food insecurity, transitional housing, supportive services, the care navigation and care coordination services, all the things that Eamon mentioned at the top of the session. And we really believe in what MIC is doing and what MIC is uncovering in innovative solutions between private sector and public Medicaid programs. So we're super excited about the work that has happened to date and what is coming thereafter. We really do believe that integrating social care into our managed care delivery system is critical to our long-term success and to improve the outcomes for our Medicaid members. And we're very excited to be part of this and want to thank MIC for convening this wonderful group. Thanks, Vinu.
Great, thanks, Amir. I really appreciate those comments. And now I'd love to turn it over to Lisa Lee from Kentucky to share a few words.
Hello, I'm so honored and glad to be here and part of this collaboration. I am Lisa Lee, I'm the Medicaid Director in Kentucky, and just like to thank everyone for their participation in this very important endeavor. The importance of this, the work that's being done in this Medicaid Innovation Collaborative cannot be understated. While we know that Medicaid can provide medical services to our members, we also know that social determinants of health, such as food, housing, clothing, plays a huge role in their health care. And so it's very important that we learn how we can better serve those members and bring in those social determinants of health within their medical care. In addition, Kentucky is very excited about the opportunities to learn how to improve healthcare and disparities among our population. We are also front and center with racial and health equity initiatives. We have formed certain technical advisory committees to help us identify and hone in on some of those disparities and gaps in our healthcare. And we believe that this collaboration is going to enhance some of the work that we have done. And we are so excited to be part of this, this effort. And thank you so much for your participation.
Thanks, Lisa. And I appreciate your background is very similar to our MIC background. So we have that in common. So, and now lastly, I'd love to turn it over to Director Liz Matney from Iowa.
Hello, everybody. I'm so excited to be here with Lisa and Amir's teams. What a great group. From my perspective, there's no shortage of areas that we're working on improving in Iowa, just like all of our counterparts across the entire country. There's a lot on the plates of leaders who work within the Medicaid sphere. And we've been talking about social determinants for years and years and years, right? We haven't really done a lot with it until recently. The bright side of the pandemic is that it catapulted us beyond our hesitations for using tech-enabled solutions. Like, just think, 4 years ago, we hardly used telehealth at all. And now it's incorporated into the everyday in terms of how we set up services for our members and deliver services to our members. And things like closed loop referral systems and information portals are no different. This is the new normal, and we have to be there to embrace it. If we want to make true difference in people's lives, we got to meet them where they are, where they feel comfortable, and where they can be best equipped. And so I just want to thank everybody for being here today. I'm super excited to see the presentation and see what will work for Iowa.
Great, thank you so much. Really appreciate all the directors sharing their comments and setting the context for today. Before we start with the company pitches, we also wanted to highlight the voice of one of our consumer advisors who's been actively participating in our consumer advisory board. Just to set some context, this board comprised of 15 consumers from our participating states has been critical. They've been giving us great feedback on the research, helped us really better define our RFI, and have been reviewing a lot of the solutions and really rooting our work in the experiences living with many of these challenges in their communities. So I'd love to introduce Stephanie Ampofo. Hi Stephanie, there you are. If you could just say a few words as to why this work is important to you as someone living in one of the communities.
Absolutely. Thank you guys for sharing ahead of time. I would like to say good evening to everyone, state Medicaid directors and members of the Medicaid Innovation Project alike. I'm Stephanie. I'm a stay-at-home mom, and this project is a wonderful opportunity for people like me that live in Kentucky in a rural area. I'm a married mother of 3 young children, and my husband is medically retired from the Army, but his income is still below the poverty line. I do not have a chronic health condition, but I still need access to affordable health care. Without Medicaid, I would not be able to afford the care I need for my children. This project will allow me to get the health care my children need to stay healthy and grow. They will be strong and beautiful and thrive. I will be able to see their doctor more regularly and get their medications and even maybe plan preventative health care to prevent health problems. Medicaid has also helped me to find resources, and like this wonderful opportunity in this project, it will also allow more resources to reach people like me. It's such a huge help and things people wouldn't even consider, like helping my kids be allowed to play sports or get vaccines, help me stay healthier to care for them. The project is a blessing and a caring one at that. It will allow trust and unbiased help. I believe in something that really works. By providing access through tech-based solutions, it will give access to those who can't get to help, but instead is more of a boots-on-the-ground approach on this war against stigmas and poverty. I am grateful for Medicaid and this project. It has made a real difference in my life and the lives of my children. I urge you to continue to support this project as MIC is giving me hope. To speak to my personal experience, I have suffered many health problems, such as tooth decay, and that's just from trying to consume for the sake of being full instead of healthy. I have experienced hunger in the past and really just uncertainty of where to turn to. I love my kids, and I was afraid to reach out in fear of someone not understanding. Things are better now, but this was a personal journey, and I'm confident that there are so many that's still facing this in my area. The school, through some existing approaches, has helped me before in this type of way. I know that these approaches to localize more familiar churches and more familiar community-based places will be so beneficial. I want to thank you all again for allowing me to share and hear me out. And guys, it's really personal, and I'm sorry I'm so emotional, but it really means a lot to me. And I want to thank you guys for allowing me to share with you how much this really means to me. And I know it means to other people in my area. Thank you.
Thank you, Stephanie. Really, really appreciate your story and your honesty and how important Medicaid and getting these services means to you and your family and your children. So thank you so much for that. So now we're going to be transitioning to some round robin pitches to be able to see some of these companies that can help Stephanie and people living in the communities, as well as to help as the Medicaid director shared some of the really important priorities in their communities. So as you listen to these solutions and have the conversations and the breakouts, we also want to let you know that we're exploring the opportunity to provide financial assistance to pilot some of these solutions in your communities. These pilots would allow us to test and evaluate the impact for people on Medicaid. So just to keep that in mind, as you think about the potential partners, really start asking those questions that will allow you to take that next step to be able to see how these solutions could be implemented. So hopefully you all had an opportunity to view the videos that we sent last week. The welcome packet also contains information for each organization and their presenter. So there's a little profile for each of the presenters today. We thought this round robin would serve as a quick refresher for each of the solutions, although they will be quick 2-minute pitches. There will be time for in-depth Q&A in the breakout. So rather than asking questions during the pitches, we're asking you to just take notes of any questions that come up, and you'll be able to use that time in the breakouts to get at those. So this is the order that we're going to be presenting the solutions. We're going to first go through the 3 food insecurity solutions and then into the navigation solutions. We're going to be following a strict 2-minute cutoff. As we get close to the 2-minute mark, I'm going to come back into the screen, and that's going to be an indication that you need to stop. And I have been practicing cutting people off, so I will will unfortunately have to do that just so we can get through all of that. So with that, I'm very excited to queue up Jen from FarmBox to talk about your solution. Hold on, let's wait for Jen to come in.
Sorry, it's actually Ashley's giving our intro.
Oh, okay, sorry about that. So it's Ashley, yeah.
Thank you, everybody, thank you for your time today. I'm Ashley Trenier. I'm the founder and CEO of FarmBox RX. I founded the company almost 10 years ago. Backing up to 13 years ago, I was pregnant, on food stamps, living in a rural food desert with my now 12-year-old daughter. This was before the time that SNAP and EBT was able to be accepted online as a form of payment. We have always worked to eradicate the food desert problem that America faces. During the Obama administration, I worked alongside Sam Cass, who's a senior policy advisor to the Obamas for Nutrition. Sam and I worked together to help create the first pilot to accept the SNAP and EBT card online as a form of payment. 3 years ago, when CMS changed regulations around food and produce being able to be offered as a benefit to Medicare and Medicaid recipients, I launched FarmBox RX out of a spinoff of our direct-to-consumer entity, FarmBox Direct. We launched with just one health plan in 2020, Vibra Health, which is actually owned by Capital Blue Cross in Pennsylvania. And all they cared about was just gaining membership and member satisfaction. Over the past 3 years, we have morphed into a patient engagement company where we identify as food as engagement. The reason that engagement is incredibly important is because if you don't have members engage with the food that you are sending to their home, it is not going to be useful for them. We found our home in food as engagement by engaging members in Medicare and Medicaid on the plan's quality initiatives. So think STARS ratings, HEDIS side of the house. We have proven to be one of the best care management interventions that Molina Healthcare has ever implemented in the state of New Mexico. Now, as a company, we have the top 5 payers we are under contract with. We have the privilege of serving over 3 million Medicare and Medicaid members under our umbrella of FarmBox RX. And we truly created this space within healthcare of engaging members with the food that we send to their home on a national basis, on other metrics that the health plan needs to move the needle on. You remember that, of course, the ridiculously obvious notion that if you eat
Ashley,
healthier,
I'm gonna have to cut you off and like,
okay.
yeah, if you want to say the last sentence. Yeah.
Thank you.
All right.
Stephanie, I just wanted to thank you for sharing your touching story today.
Thanks, Ashley. Okay, sorry about that. We're on a tight schedule, so we're going to keep everyone moving. Next, I would love to introduce Emily from Free From Market. Hi, Emily.
Hi, I'm Emily Brown. I'm the co-founder and CEO of Free From Market, a patient-led digital health company that brings together personalized food selection with nutrition coaching and education. Our patient-led solution is built out of my own lived experience. I'm a mother of 2 children who have chronic health issues, where food is part of the standard of care. We were on WIC, SNAP, and Medicaid, and still found it difficult to access the foods that we needed. This led to my work as a professional patient advocate, sitting on councils and work groups at the NIH and CMS. Together with my team, we harness the power of empathy and expertise to bring food and nutrition care to scale for better health outcomes and life-changing results. Right now, Free From Market is growing rapidly and is in talks with some of the biggest healthcare providers in the country. What they say makes us stand out is our unique end-to-end closed system where we manage our supply chain, one of the only organizations in the space to do so. This allows us to provide you 2 key value differentiators. 1, reliable delivery in rural and hard to reach communities, and 2, consistent high quality food, produce, and meals and nutrition care at scale. Additionally, because over 50% of our users are currently on Medicaid, our depth of experience enables us to change behavior and solve problems across populations and disease states, such as metabolic disease, maternal health, and celiac disease. It's not just enough to have access to the right food, but support and empowerment through education is key. So that's why we have a certified health coaching program that allows our coaches to work one-on-one with members to further improve health outcomes by making it personal. I'm thrilled to be here with all of you and look forward to answering your questions about how we can partner to achieve desired results for your organization and health and happiness for your members. Thank you.
Great, thank you, Emily. Appreciate that. So now our third food and nutrition company, we'd love to have Lauren from Nourished RX.
Great. Thank you so much, everyone, for being here and having us here. I'm the founder of Nourished RX, and I got into this food for health space early because my son, as a little guy, had some scary health problems. And fortunately, nutrition really ended up being a huge part of the cure. And I just realized what a crime it is that so many do not have any options when it comes to nutrition. So at Nourished RX, we are improving people's health through nutrition in partnership with healthcare payers. And the good news is we are moving beyond mass-produced medically tailored meals and nutrition advice that's kind of hard to follow. So thanks to our technology and behavioral science, we're able to deliver appealing, locally sourced food that is culturally responsive and provide the right coaching and support at the right time and do this at scale. We've been able to show median A1C reduction of 2 points, reduction in NICU admission.
Sorry, go ahead, Lauren. We'll give you a couple extra seconds.
Yeah, it sounded like I was muted.
You were muted, yeah. So maybe if you want to start up from after you talked about diabetes.
Oh, that's so strange because I did unmute myself. Okay, so yeah, we showed a 2% reduction in A1C for NICU admissions, a 30% reduction, and we just completed an analysis which showed $474 per member per month in savings for our heart failure program. Health plan partners are really appreciating our ability to support equity and quality initiatives, and our members are asking for more. But what I love most about our work is that we do our work with the members themselves and we tap into the communities they live in. So we optimize solutions according to individual member expressed preferences and circumstances, and we strive to source locally to be authentically culturally responsive and to invest in the local communities. I look forward to you meeting my colleague Jacinia in the Q&A, and again, thank you so much.
Great. Thank you, Lauren. We appreciate that. Okay, let me just see if we can get the spotlights shifted. And before we move on to the next one, perfect. Okay, so now we are going to shift from the food insecurity solutions to our navigation solutions. And we're going to start with Andrew from Live Chair Health.
Hello, everyone. Andrew Suggs, founder and CEO of Live Chair Health. It's a pleasure to be here. Live Chair Health is an innovative member engagement solution that closes care gaps and HEDIS measures by engaging health plan members where they live, work, and play. Why have we taken this approach? We know that MCOs, if they believe health inequity has resulted from traditional member engagement solutions, they must do something new and different to create health equity. And what we like to say is they must close cultural, access, and trust gaps to close those care gaps. And so let's double click on a few of these points. So cultural gaps, you have to meet people on their level with vernacular and cultural knowledge to achieve any momentum. As we all know, all communities are not built the same. Access gaps. Many Medicaid members defer attending provider appointments because of a lack of transportation, for example, which leads to Medicaid members not consuming healthcare services that will keep them healthy. And lastly, and I think the most important, is trust gaps. Many Medicaid patients don't trust the healthcare industry because of historical plagues like the Tuskegee syphilis experiment, which negatively impacted the Black community specifically. Fortunately, I believe that Live Chair Health's omni-channel platform that closes care gaps and HEDIS measures where Medicaid members live, work, and play gives us multiple channels and opportunities to engage members when pure tech solutions fail. And we've seen that this hybrid approach of high tech and high touch, and importantly, knowing when to use either method, is how Live Chair Health has been able to achieve 7x and 8x engagement rates, which we think is best in class for some of our managed care organizations today. So why choose Live Chair Health? Because fundamentally and foundationally, we are a trust company. And with that trust, we can build stronger, stable, and healthier communities. Hope to lend more comments to your ears if you decide to choose my breakout room. Thanks, and have a great day.
Great, thank you, Andrew, appreciate it. Next, we are going to turn it over to Neil from Pear Team. Welcome, Neil.
Hi, everybody. My name is Neil Batlivala, co-founder and CEO of Pear Team. Thank you so much for the opportunity. At Pear Team, we find, engage, and care for our country's highest need Medicaid beneficiaries, such as those experiencing homelessness, severe mental illness, or substance use. And we do this by building a contracted network of community-based organizations like shelters, food pantries, sobering centers, and wrap them with our own medical group and multidisciplinary care teams. By integrating CBOs into our care model, we not only drastically improve access to care, but also build trust with our most vulnerable communities. And we don't just partner with our CBOs operationally, but also technologically and financially, offering remuneration as a formal entity in our care delivery network to support engagement and ongoing care management. The existing primary care network is swamped. We all know that, and they don't have the resources to provide timely trauma-informed care. This is why we wrap our partners with a multidisciplinary care team, including community health workers, behavioral health specialists, and an NP-led virtual primary care offering in order to provide true whole person care. We've been live in California. We've demonstrated more than 50% engagement of some of the highest need individuals and have early but significant clinical outcomes, including a 17% reduction in ED utilization. And all of this comes together with our community health and technology platform. It's shared by our internal care team and our community partners. It's the technical foundation that lets us build this socio-clinical data set so that we can use data science to drive improvements to access, quality, all while reducing costs. So to summarize, Pear Team is building the playbook and technology for a new type of clinically integrated network, one that includes community-based organizations as formal entities with payment schedules, utilization management, and other best practices to build what we believe is a sustainable solution to address health inequities. Thank you.
Great, thanks, Neil. Now I'd love to introduce or welcome Jonathan from Samaritan, if he is here.
When you don't have a home, you can't take care of your health. When my friend Nicole experienced homelessness in Seattle, she was 8 times more likely to get hit by a car, to be abused, to succumb to a substance use disorder, or simply face isolation that would drive her into the ED or hospital. Samaritan is a support platform that helps its members access the financial and relational capital needed to address their social drivers of health. Health plans like Elevance and Aetna are deploying Samaritan now to help last mile populations gain capacity to take advantage of community resources in your existing interventions. Here's how it would work for your members. First, we will work with your existing provider and CVO network or build our own to get free Samaritan memberships to your targeted members. Folks can become a Samaritan member at ED discharge, street outreach, and case management, or other contexts. Members get this member card, sharing SDOH goals and breaking them down into immediate needs and desired action steps. From there, our members gain financial and social support from Samaritan's network to meet needs and earn bonuses by taking those action steps towards their goals. They spend funds using this card with a case manager who can order whatever the person needs through our platform. This member card also securely stores critical documents and doesn't require the member to have a phone, an email, or a bank account. Over time, our members measurably improve access to care, critical utilities, and/or housing in an average of 6 months. These SDOH outcomes significantly reduce a member's need for the hospital, for the ED. In one case in LA, reducing total cost of care by 32%, 6 months pre-post. If you'd like to get Samaritan memberships out to people you serve, please stop by our breakout room. Thank you.
Thanks, Jonathan. I love that we're stopping by breakout rooms now. So now I'd love to turn it over to our next company. And we have Rajay from Waymark.
Hi, everyone. It's great to join you today. I'm Rajay Batniji, physician and CEO of Waymark. We're a public benefit company that's dedicated to improving access and quality for people enrolled in Medicaid programs. Let me start by just giving you a little overview of what we do. We partner with Medicaid health plans and primary care providers to deliver for the first time technology-enabled community-based care. For me, what was striking is we know these programs work. If you look at the evidence for CHW programs or RAP services for PCPs, particularly when they're augmented by data science-led interventions, you see sharp reductions in cost of care, you see reductions in ER visit rates, you see, importantly, improvements in clinical outcomes, reductions in NICU admissions and readmissions. But we haven't been able to scale these programs. Why? There's not really funding for them. These types of interventions, a longitudinal community health worker is not paid for under a fee-for-service. There's not usually a community health workforce to actually operationalize and implement these programs in communities. And there's been a lack of technology. Nobody's ever built the product to enable implementation in the community. And that's where Waymark comes in. We're building for the first time a new community health workforce, training and employing people from within the community to become health navigators in their own neighborhoods, supplementing them with pharmacists and therapists. We're enabling that workforce to deliver really evidence-based interventions using our technology. And we're paying for that workforce through value-based arrangements with health plans. We're working with both large health systems and FQHCs as our partners so that we can actually extend them into the community and allow them to move to value-based arrangements. And for patients, the benefits of this approach are threefold. One, this is local support. Our teams are in the same neighborhoods as the patients we serve. We understand those communities. Second, we're providing wraparound services to the PCPs and their patients. So not replacing the PCPs, but really extending them beyond the clinic. And third, our model is based on evidence. Our team's based on, our approach is based on randomized trials focused on people receiving Medicaid, and we're really scaling what's been proven to work, studies that our team has been leading for many, many years. We're currently serving communities in Washington State and Virginia and seeing really promising signals of impact, and excited to bring this model to communities across the country. Thank you.
Great. Thanks, Rajay. Appreciate that. And last but not least, we have our last company, which is Stephen from Wellfy. So welcome, Stephen.
Hi, can you hear me?
Yes, perfect.
Hello, everybody. Thank you so much for your time today. I'm Dr. Stephen Moyo, CEO and founder of Wellfy. I'm a first-time founder, but a three-time immigrant. And I mention that because one of the things we focus on is community health workers, behavioral health coaches, peer counselors, as well as doulas. We call them heroes at Wealthy. They're our health equity response organizers. And one of the things that we do is unique is we focus on kids and their families, and we meet them where they show up most, which is largely K through 12 schools and out in the community. Our platform empowers our heroes to be able to send out health education, improving health literacy, as well as assessments to families. We're actually integrated in Power School, the #1 student information system. We're integrated into Allscripts, the #1 outpatient electronic health record, and soon Epic as well. Based on this data, we build a comprehensive and longitudinal health profile for your families, and we're able to act on that data, coordinating care and referrals to providers that are in the community, as well as utilizing the school district resources to be able to provide upstream community-based care for your families. Providers can connect on our platform. Virtual care and quality care metrics are being tracked. We focus on HEDIS, CAPS, those stars rating that are so important to the bottom line. But what's really important for us is the families. We focus on the kids because we know that they're the most powerful force for change, not only in their home, but in their school and community. And especially at a time where we're experiencing a mental health crisis, this is key. We've secured partnerships with Cigna. We're in an incubator right now that is sponsored by Humana, and in our pipeline are organizations like Blue Cross Blue Shield. And one of the key things we're doing with our platform is we'll be aligning with the NCQA digital measures with the goal of being able to report this information out not only to payers, but state Medicaid agencies. And we're participated in national accelerators alongside HHS, Health and Human Services as well. So please stop by our room, and looking forward to discussing more. Thank you.
Great. Thanks, Stephen, and wanted to thank all of our presenters today. As you just witnessed, some really impressive solutions. Really excited for you all to learn more now, as now the fun begins. So what we're going to be doing now is we're moving into the breakout room portion of our program. Today you saw 8 different solutions, and now you have an opportunity to go deeper with 4 of them. So we're going to have 4 rounds of breakout room sessions, each lasting a little under 20 minutes. And each breakout room will host 1 company, so that 1 company will stay there. And at any point, you'll have an option to choose from those 8 different companies. Each room will have a representative from MIC or Acumen who's going to act as the facilitator. But really, this time is for you to ask those questions that you really want to understand to get a better sense of how that solution could work in your community. When there's about a minute left in each of the breakouts, we're going to cue you to rejoin the main room. We'll take a couple seconds to breathe, and then we'll send you back out to your next breakout room. So hopefully that all makes sense, and we're planning on doing that 4 times. So if there's any questions, feel free to drop them in the chat, but hopefully we'll be able to get through that. So on the next slide, we just wanted to go through a few ground rules for the breakout rooms. One is we want to have, we have limited time in these sessions. So we want to keep your questions brief so that the companies can be able to respond to them, and hopefully ask the companies to be able to also keep short responses so that everyone has a chance to participate. First, we'll utilize chat for comments and questions, but obviously if you have a question that makes much more sense to ask verbally, we ask just that you raise your hand and the facilitator will call upon you. What we're hoping for this to be really successful is that you try and distribute yourself evenly among the breakout rooms. So as that prompt comes up, you'll be able to see how many people are starting to populate each room. And just to remember that you have 4 chances to see the company. So, if you don't get that company the first time, the second or third or fourth time, you'll be able to get in there. Also, just a quick note that we are recording the breakout rooms, but it's only for internal purposes to capture the questions and potentially follow up if states or MCOs would want to talk about next steps. We're not going to be publishing these in any public forum. So with that, we would love to show you how this works. So each company is assigned to a room number. So for example, if you're interested in FarmBox RX, you would select room 1, or Waymark is in room 7. Once we open up the breakout rooms, you'll see on the bottom of your screen, there'll be a little box with those 4 blocks that says join a breakout room. And then you'll get prompted to select one that is associated with a room that you want to go through. So hopefully that makes sense. And now we're going to head off to our first breakout room. In a moment, you should see that pop up. So feel free to select a room.